Postpartum hemorrhage is the most common complication after childbirth that a woman can experience. It is also the leading cause of maternal mortality and morbidity in developed and developing countries across the world. Blood loss can occur vaginally or it can occur intra-abdominally into the broad ligament or into hematomas arising from genital tract trauma. Internal bleeding can be the more subtle and less obvious form of hemorrhaging because there is no obvious blood seen. There are two types of hemorrhage. The first type is primary postpartum hemorrhage. This occurs within the first 24 hours after giving birth and is the more common one. Uterine atony, which is the relaxation of the uterus, is the most common cause of postpartum hemorrhage. Uterine atony hemorrhage can occur slow and steady. It is important to palpate the fundus after birth in order to make sure that it is firm and intact. A boggy fundus needs to be stimulated for contraction. The second type of hemorrhage is secondary postpartum hemorrhage. This can occur anywhere from 24 hours after birth all the way up until 6 weeks after birth. This type is most commonly caused by failure of the placental fragments to return to normal size after birth. This stage is less common than primary postpartum hemorrhage, but can be a stressful period for the family because they have returned home at this period. Some nursing actions to take during the postpartum period to minimize the risk of postpartum hemorrhage are to palpate the fundus at frequent intervals following birth. If the uterus is not firm, there are several methods that can be used to ensure that the fundus contracts. Massaging the fundus is the first step in attempting to get the fundus to firm. Medications such as oxytocin and misoprostol can be used as stimulants. Surgical interventions can be used in the event that medications do not work in resolving the issue. Early and prompt treatment can help save the postpartum woman's life. So in the event that hemorrhage does occur, there are important actions that the nurse should take. First, you want to call for help and initiate the rapid response team. Massage the fundus until it is firm. Administer prescribed meds. Replace fluids and administer blood transfusions as ordered. Administer oxygen. Maintain accurate intake and output, and that can be done by using the Foley. You want to assess the blood loss. Weigh peri-pads. Monitor pulse and blood pressure at frequent intervals, such as every 15 minutes in the event that hemorrhage is occurring. And prepare for surgical interventions as needed. These are just to name a few of the interventions that can be done. There are several more interventions that can be used, and also non-surgical interventions that can be used in the event that hemorrhage does occur.